77% of sodium consumed by Canadians are from processed foods, sold at grocery stores, and from fast food, which is my favorite thing to eat. Now, the recommended 1 teaspoon of sodium, we surpass it by far. So tonight, at the Healthy Hearts Chef Challenge, we're going to learn how to create healthy meals, but tasty, that are low in sodium. So let's go inside and take a look.
Initially, we interviewed about 33 wineries, and we ended up choosing about 3.
My grandfather always said that nothing is gained by just sitting around and waiting for it to come to you. You have to go and get it. And he was a very strong believer in self-determination. And he was one of the most focused human beings I had ever met. If he wanted something, nothing got in his way. So, and he instilled the same values in us. The wine journey has been a difficult one. It's been a challenging one, but it's been a rewarding one because we're in 15 markets now, and the wines are doing really well.
We are at the LCBO.
Cardiac Health Foundation of Canada. We're for prevention, education, and cardiac rehab. And we always do public education lectures to help people look after themselves, look after their hearts, and learn their risk factors. We're finding that people don't want to go to a lecture. So we had to come up with a unique way so that people could learn about the risk factors, about heart disease. So what better way than to cook and eat and sample and look after your heart? Because we do a lot of lectures to seniors who are at higher risk of heart disease, we've been working with several seniors' homes, and it's important that we educate them to look after themselves and to look after their hearts, to know the risk factors, to know the signs and symptoms of stroke and heart disease. So we thought, okay, why don't we do a chef challenge, get them to compete, and then after that we'll go to the winning homes. They're all going to get it. We're all going to do lectures for all of them and educate them.
A little while ago was on Dragon's Den and was successful.
And the whole idea is to try and have foods that are still tasty, because I don't want people to think, okay, healthy eating means carrots and celery and stuff like that. So that's why we're looking at chefs, saying, chefs, can you help us out in picking foods that are tasty, that we like to eat, but that are good for us? And if we can marry those things together, we don't have to do these salads all the time. There'll be some parts salad, but then there's going to be fish, there's going to be lean meats and things like that. And what are the spices that you could put in without using a lot of salt and all this kind of thing? So these are the tips that we're trying to learn from these chefs.
Entrees or something like that.
Yeah, and I'm here for the wine. So.
Right, okay.
For a healthy breakfast, low in sodium, what do you guys have for me?
I'm going to offer you poached eggs on a multigrain bread.
Is there butter in that?
No butter.
Fine.
No butter.
That's fine.
Nope.
Lots of fresh fruit on the side.
Lots of fresh fruit.
So how does one make a perfect poached egg?
You can bring your water to a simmer, add a little vinegar so the egg will stay together, and you just drop your eggs in and let it go to the doneness you want. Lift it up, put it on a towel, dry it off, and then set it on your bread.
For dinner, we have today what we are presenting is salmon, which has all the omega-3 oils in it. And it comes with quinoa, roasting, and that's good, as good as meat. It has so much of protein and filled with all omega fats and oils.
People make boring salads. So our salad that we typically like to do has a lot of different types of greens, Swiss chard. We can throw some cool lentils in there, some corn, and then we roast pork tenderloin. Yes, pork is healthy. We roast it, we put it right on top, and a nice vinaigrette on top. It's gorgeous and filling and so nice.
All right, we got a question from the audience.
Oh, great.
This is our event for Heart Month, and it's our kickoff for our Walk of Life, because then we want the whole group to be part of the Walk of Life, which is on May the 28th. It's at the Ontario Science Centre. But we also have Walk of Life all across Canada. There's 30 Walk of Life, and we give money to all of them to help them with their cardiac rehabilitation programs.